That's
Trying to get through all that.
It's a tripod.
I didn't need to offer your stuff. I just know that you bring it.
Is that, Michelle's asking, is that how you film your daily videos?
Okay, did we go through human leg press last time? Was that what Dr.
Look at. Just look at Leonard.
Okay, I'm just gonna go as if we haven't done anything. Okay, so
It's like, what do we do?
not done super frequently, but depending on the population you're working with, you guys can come around. I feel like you guys used to gather. You don't have to. I'm just whatever's best for you guys. We got all sorts of cameras set up
I feel
today.
like we could see.
But this is one that you will do. You probably wouldn't do this with, like, you know, your athlete that's back squatting 400 pounds because he's going to throw you across the room. But I'm not worried about that with this patient.
Are you?
Should be.
So this is one that really thinking about the setup is important. The table is a little low for me, but again, just because I like to showcase body mechanics sometimes. You should have the table up higher so that you don't have to do what I'm going to do, which is I'm going to end up squatting down really low. So I'm going to show you why body mechanics are so important. So I want to assess her range of motion. I can passively take her through and make sure she has full hip flexion, which she does. Can you go ahead and do that by yourself? And extend. Have I assessed any strength in her ability to extend her hip?
No.
Very, very little. What part of the range are her hip extensors active?
The lowering.
Which she's bringing her leg down?
Yeah.
The whole range?
No.
What part of the range? So from here to here, right?
Yeah.
So there's a little bit of active hip extension concentrically. There's also eccentrically when she's doing it this way, here. Probably going through tension, it might still be active hip flexion, but that is debatable depending on your patient. It depends. Okay, so I know she has a good amount of hip flexion, and I know her leg can go all the way down to the table. I want to have her slid as close to the side as possible. For me, applying my force, I could try and like get her leg off the side and go into some actual extension, but that probably wouldn't be very safe. So we'll just do it here, close to the edge for my body mechanics. You should bring the table up higher, but you should be using your legs and going into a lunge. So I'm going to show you a nice deep lunge here. Hand contact, there's a few different options. Again, as I mentioned, you can have one hand on the bottom of the foot. The other hand, I'm going to externally rotate supinate. So if I'm pressing this way here, my hand contact doesn't change. Go ahead and press into me, patient. Press. What are we strengthening?
Quads.
What are you using your quads, patient?
Hamstrings.
Maybe we shouldn't do this with towels here. Go ahead, hold on to the side of the table. Okay, so we are, what type of contraction is she doing here? She's doing a concentric contraction?
Concentric of hip flexors.
So if I'm pressing on the back of her thigh and the bottom of her foot and pushing this way, is she actively using her hip flexors?
No.
Eccentric hamstrings.
Eccentric hip what?
Quads.
And
And eccentric for both, no?
Oh.
I underestimated you, patient. See, this is why you don't do this with strong patients, because weird things will happen. Please keep your hips on the table. We're just trying to isolate the strengthening to your hips. Okay.
So what is she's resisting going into knee flexion?
So if I am pressing this way, don't make me work so hard so I can still talk to them. So if my force is here, not so hard, patient. Let me win. Which is actually one of your cues when you're doing your eccentric contraction. So my hands, the direction that I'm pressing is going to tell you what is being strengthened. So this is probably the easiest position to see what she's using. If she's concentrically going here, so go ahead and press, patient. She's extending her knee actively, and she's extending her hip actively. Make sense? So I didn't change my hand contact, so we are now eccentrically strengthening the same muscles. Make sense? So if my hand contact is here, we're going through this motion, eccentric hip and knee extension, concentric hip and knee extension. If I change my hand contact to here and here, I'll go here. So now go ahead and flex your hip, bend your knee. Bend your knee, bend your knee. And your hip. Bend your knee. So let's try that again. So you're pressing into both my hands. You're flexing your hip and bending your knee at the yeah, there we go, good. So this is now
Concentric hip and knee flexor.
What type of contraction did we just do? Concentric. Resist me, but let me win. Eccentric. So let me win is your best cue for eccentric strengthening, or let me move you, either one of those. But sometimes you say let me move you and they just go totally limp. Yeah, slow me down, let me win. Those are all good ones. And then concentric is more like cues for your MMT. You're pressing into my hand, you're winning, and just kind of telling them the motion that they're going into. So other options, some people who have a harder time, maybe you're not as strong in your arms, you can put, and this is where you definitely need to go higher with the table, but I could still do it from here if I wanted, is hand on shoulder, and now, yep, slow me down, but now I have to almost like walk my way up, and then quick stretch press, you're gonna extend your leg, bend your knee, or straighten your knee. If I go really wide, I can just kind of shift onto one leg. And I need to get as low as I can because I need to get her through as full of the range as possible.
Is it quick stretch kind of like an overpressure?
Yes, exactly. Quick stretch is like an overpressure. It's just a little range of motion. You do not, so when you're starting, the direction that you're going from, if we are here, I don't want to wind her all the way up into end range, and crank there. So I would come out just a little bit for my end range quick stretch. And then I don't know if you saw, but when we were first teaching her the motion and she wasn't totally getting what I wanted her to do, I can give her another quick stretch in the mid range where you're feeling that weakness in order to get that muscle response from the quick stretch. Make sense?
Is this like for somebody who was like a 3+ on strength in their lower body? It
could even be a 3. Yeah.
Okay.
Yeah, and I mean in the legs, yeah, we'll just do these. A 3 would be your ideal person, or you know maybe they're like a 4, but maybe they're an older, more frail, or maybe they're recovering from some type of injury. You don't have like a total gym, or you know, I don't remember the names of the machines anymore because I don't ever. What's that? That's more like the bike one, right?
Recumbent pressing above.
Yeah, so that could be used for. I think of that as more, but yeah, that could be strengthening too. So if you don't have any type of like machine to put them on, so that they can do reduced body weight, lower extremity strengthening, that might be a time that you might be using a little bit more of this type of technique. I do it sometimes in home health, but I'm usually not bringing my treatment table in with me for home health, and I don't like to do a lot of stuff out of people's bedrooms, but sometimes I bring my table, sometimes we do stuff out of the bedroom. Teaching people how to get in and out of bed using their bed is sometimes important. I'm doing that with a few patients right now. So
You were talking about like if you get a strong athlete but they can't hold in a low squat, would you use an MRE for that purpose or no?
Unless there was like a really significant So maybe they're not squatting full depth, and you just did some techniques to loosen up their hip capsule. Maybe there's like an impingement going on, so they're just like super weak there. They've been like neurophysiologically inhibited, and you're trying to get some activation. But that would probably be more preparatory and just getting the muscles to turn on prior to having them doing it in a standing position. Again, your athlete should, even their weak points should be a little bit stronger than most other people's. So I've never done this with like an athlete. But was it? Or post-op, yeah. Post-op, you could do it depending on what the injury was. Internal, external rotation, I'll do manual with athletes sometimes. And we'll go through all those in a little bit. You guys want to practice this one? So the hand contact, you have two options for doing extension. You can be here or here, okay? For working on the flexion, it pretty much should be distal thigh and distal tibia. Some of you may try doing this way, but I feel like this makes my right arm work way harder because I'm going into external rotation. So generally, most of you should be doing it here, but like I said, if for some reason something's more comfortable for you and you feel like you're getting a better response from your patient, then that's where you guys have to do it. So hip flexion and knee flexion together, knee extension and hip extension together. Let's practice those. Bring the table up a lot higher than I did, unless you have as good of a lunge as I do. And then we'll talk about the isolated versions of these after.